Good evening, everyone, and welcome to OET Listening Prowess. This is me, 𝐻𝐬𝐬 𝐋𝐢𝐬𝐭𝐞𝐧𝐢𝐬 joining you from Nita Academy. Yes, we've come with yet another OET Listening Live to help you with your listening. So, how are you all doing? We're a bit late today, but let me know in the comments how we're all doing and how everything's going and how your practice is going and things like that. I'd really love to know about it. And how was your listening practice going? Is it going really well? Are you all having fun? Some students tell me when I ask this question to them, they have this opinion that I should never put fun and learning together. But it must be put together because learning is a process and you have to do it almost every day. And if you have to do something every day, then you really do have to love it. And if you have to love that process, it has to be fun. It has to be so much fun. So you should find some ways to make it fun so that you would love it, so that you would do it almost every day and you would do it consistently and it wouldn't seem like a burden for you. So in OET Listening Prowess, we aspire to make this a fun process for you. At the same time, we want you to learn the whole thing. So all that you have to be learning, and we think of giving really good tips and strategies for you to have a better score in your subtests. Okay, so those who've watched or those who have seen our OET Listening Prowess live would know the drill, what we usually do. What do we usually do? You can comment the drill. What we usually do is we show you a video, basically. I mean, it's actually the audio plus the questions would be displayed on the screen. And you will write the answers on a piece of paper. And after that, we will show the questions once again so that you can take a note of those questions, or you can take a screenshot of those questions on another device if you have another device with you. And then so that you can refer the questions while we're discussing the answers. After which, we move on to the discussion part where we discuss the answers with the help of audio script. And that is the interesting part of OET Listening Prowess, because we actually discuss the answers with the help of an audio script. So you do have an audio script in handy, because in most of the times in classes, I'm sure teachers wouldn't be able to discuss each and every part of it. But in OET Listening Prowess in this live, we will be discussing each and every word that you heard in the audio. Because when we're showing you an audio script and when we're going through each and every word in it, it would be easier for you to understand which word you heard in the wrong way. Okay, how you actually heard it and what that word actually is. So you will have an idea about those things, and that will help you improve your listening skills, and that would give you more confidence. Okay, that's why we do that. And when what we do here is on each live, in each of our lives, what we do is we cover each part. We cover each part of the listening subtest. So in the previous live, we did basically each extract. I would say we cover one extract in each live. For part A, we did part A extract 1 and part A extract 2. So in the previous live, what we did was we did part A extract 2. So in this live, we'd obviously be doing part B. Part B just has one extract, right? It does not have two extracts. So part B, 6 questions. In the upcoming lives, we'll be doing part C extract 1 and part C extract 2. So those who are weak in part C and part C extract 1 and extract 2 can wait for the upcoming lives where we will be discussing that. So in this live, we will be focusing on part B, 6 questions. Question number 25 to 30. So you know that we have 6 questions in our part B. And I would say part B is comparatively easier than part C. Because for part C, you're given 90 seconds to read all the 6 questions, okay? and then the audio is played. So what happens is, by the time you're done reading the 6th question in extract 1, you must have actually forgotten what the other 5 questions are, and it would be actually really difficult for you to remember what those things are by the time you listen to the audio. So it's quite difficult, but with practice we can make it easier. There are certain things that you can do to overcome that struggle we have in part C, which we will be discussing in the upcoming lives. But part B, when it is comparatively easier for that matter, I would say, because what is the reason? For each question you're given some time to read it. Okay, for question number 25 you're given some time to read the question. For question number 26 you're given some time to read. Likewise, you're given some time to read the questions, read each question, and then the audio is played, and then they move on to the next question. So it's quite convenient and it's quite easy, but still students make mistakes there. So if you're looking for a B, then you need to have at least 4 out of 6 for part B. Only then, when you take the overall score, when you take the total score, you would have something around 30 or above, like 33 or somewhere there, and that would give you an easy 350 plus or B. So what you have to be careful is just reaching this 4 out of 6, at least 4 or above. 5, 6, that is well and good, but at least 4 out of 6. So what do you do for that? Okay, so for listening, you know what you usually do. You read the question. Here you don't have to anticipate. It's really difficult for you to anticipate it because we need the information from the audio, because the answer is completely dependent on the audio. So you cannot actually anticipate. We cannot use our common sense. So if in the audio they say sky is red, you have to write that. That option would be right answer. So we have to depend on the audio. So anticipation wouldn't work in part B. So what will you do? You have to underline the keywords. And here comes another problem. Some students have this confusion about what are these keywords, and sometimes we tell them you can avoid all the function words and you can underline the main words. For example, function words like is or and words like that can be eliminated, can be avoided, and you can underline the keywords, the main words in it. And then these students end up underlining each and every word in the question. So there is no point in doing that. There is no point in you underlining the whole thing. So you have to underline the keywords. So how do you understand it? So a keyword are the words that convey the main meaning of that sentence. And the intention of underlining these keywords is that when you're listening to the audio, you should be able to understand which question is that, because after the time that's given to you to read the questions, you were not given some time again. While you're listening to the audio, you just have some time to look at the questions and the options. Basically, you're just looking at the questions. So during that time, when you're listening to the audio, you don't get an opportunity, or you don't have the chance to read them again. So what you do is you underline. You just have the chance, you just have the opportunity to just look at those things, look at the question and the options. So just underline those words that would remind you of the whole meaning of that question or that option. For example, what was important yesterday? If that question is asked, you just you need important yesterday. So underline those words. So when you look at those words like important yesterday while you're listening to the audio, it should remind you of the whole thing. So you need to underline those words that you think would be necessary for you to think about those questions. So which all words you think would be very important for you to remind you of that option, underline those words. So basically about underlining those words that would remind you of that option or that question for that matter. And active reading or mindful reading is important. that time that is given to you, you have to be very attentive. You have to read and understand that question and the options, okay? You have to read really quick, but it has to be a mindful reading. You should completely understand what's being said, okay? What's being written there. So that time has to be taken. For that, you have to improve your reading skills. You should improve your reading speed, and you should work on those areas if you're someone struggling with that. These could be the reasons why you're not scoring well. And of course, always do the script writing. I think I've explained it in the previous lives. If you want, you can go visit me this Academy page and see it. So these are the things I want to remind you of. If you have any questions related to your OET listening, please feel free to comment. Then we will definitely answer your questions, okay? And we're more than happy to answer your questions. So are these things clear to you? Underlining the keywords. So today I focused on underlining the keywords, giving you more idea about how to underline those keywords, giving you idea. You already know what keywords are and how to underline them, but for those students who were struggling with that part, I wanted to give you an overall idea about it. And for those students who find it hard to do this mindful reading, that is very important. You know, if you don't read the question properly, it would be nearly impossible for you to answer the question. So it's very important that you do it. So now what I will do is I will display the question on the screen, and the audio will be played so that you can listen to the audio and look at the questions and write the answers, option A, B, or C. So try to get at least four or above. And when you listen to the audio, always try, because they'd be talking about all the other options, okay? The multiple options will be mentioned in the audio, but you have to go for that one option which is the answer. So listen to the whole meaning of that audio and try to understand what is the main point that is being conveyed, and try to understand the gist of it, the main essence of it. All right? Yes. So so now I will show you the audio. The material will be displayed on the screen now.
Questions 25 to 30. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. Now look at question 25. You hear 2 doctors discuss the transfer of care for a patient. Now, read the question.
Hello, Dr. Salvos? This is Dr. Broderick from the emergency department. I'm calling you with regards to an admission to the hospital medicine service.
Right, yes. Hello, Dr. Broderick. I'm the admitting physician for hospital medicine. Can you tell me more about the patient and why he needs to be admitted from the emergency department?
Sure. So the patient is a 68-year-old man with a past history of CHF, DM2, and a chief complaint of shortness of breath for 3 days. Chest x-ray shows a right lower lobar pneumonia. His vital signs are normal, but his BUN is 36.
I see. It sounds like he meets CURB 65 criteria for an inpatient admission. Have you started him on any medications in the emergency department?
Yes, we have given him supplemental oxygen and started him on breathing treatments. He will also be getting empirical antibiotic coverage. If there are any other orders you'd like me to place, let me know, and I'll do so.
Question 26. You hear a speech pathologist talking to the wife of a patient who has recently suffered a stroke. Now, read the question.
I just don't really understand why my husband can't speak properly anymore. Is it a result of brain damage?
Problems of this type are a result of damage to the brain, yes, but it's important to note that these issues haven't affected your husband's intelligence.
No, of course. I know it's still him. It's just frustrating when we can't talk like we used to. Will he get better eventually?
Your husband has shown improvement already, and we're confident that this will continue with regular sessions and practice. Patients tend to show the greatest change within the first 6 months, which is why we've planned such an intensive schedule for him during this time. We're confident that we'll see great strides in your husband's condition over the coming months.
Question 27. You hear a trainee doctor asking a senior colleague about chest tubes. Now read the question.
I'm still just a bit unsure about chest tubes. I was hoping you might be able to give me a bit more information.
Okay, sure. So, you know about the 3 chambers on the chest tube, right?
Yep, there's the collection chamber, the water seal chamber, and the wet or dry suction regulator.
Right. So, as the air from the pleural space passes through the water seal chamber, you should see gentle fluctuation in the water every time the patient breathes. This is called tidling. If you notice that tidling is no longer present, the tubing may be kinked or obstructed, or the patient's lung may have re-expanded.
Okay.
You should also make sure the chest drainage unit remains below the level of the patient's chest at all times.
Question 28. You hear a pharmacist talking to a customer about pain relief. Now read the question.
Hello, can I help you?
Yeah, I get terrible backache, and my friend said you could give me some codeine for it.
Do you have a prescription from your doctor?
No, but I don't want the full strength stuff. I only need the weaker one. You know, they mix it with ibuprofen or paracetamol, so it's not as strong.
Okay. Well, first of all, there's been some research done recently that suggests that low-dose codeine doesn't offer much more pain relief than paracetamol or ibuprofen alone. We're not actually authorised to provide codeine without a prescription anymore, so I'd recommend picking up some alternative pain relief from the first aisle by the front door.
Question 29. You hear a trainee nurse receiving feedback from his tutor. Now read the question.
How do you feel you handled the patient's concerns?
Well, I think I was okay. Maybe I wasn't as confident as I could have been. I'm still quite nervous about advising patients. I guess I just need more experience to gain confidence.
Maybe, but I actually don't feel that was an issue for you. Do you think there's anything else you could have done for the patient during your examination? Well, you could perhaps have tried to be more reassuring rather than just stating the facts. Sometimes patients need to feel like their anxieties are being heard.
Yeah, I actually think I did cover this with the patient, though. He talked through his concerns while I was examining him.
Well, it's not enough for the patient to say they're feeling worried. You have to show that you're listening and reassure them that you're working with their best interests in mind.
Question 30. You hear 2 doctors planning their patient care schedule. Now read the question.
We have 24 patients in total to see today across 2 bays, and unfortunately, we only have 4 staff members. I think we should divide ourselves into 2 teams. Would you agree?
Absolutely. Also, I think we should see patients according to their national early warning score. That way we'll get through all those who have urgent requirements before lunch. Then we can be sure that the most pressing investigations are performed earliest, and the sooner we get those organised, the better. Phlebotomists will be coming to the ward at around 1:30, so any blood forms should be given to them then.
That is the end of part B.
Okay, so did you all try to answer the questions? How was it? Was it easy or difficult, or was it like some questions were confusing? How was it? Let me know in the comments. I'm so eager to know that. Okay, so we had 6 questions, just 6 questions. And I think most questions were easy if you're pretty comfortable with your part B. But for those students who are not very comfortable with it, maybe it would have been a bit difficult. But okay, so you're able to see the questions on the screen now. So now you can either take a screenshot of it and keep it with you on another device so that when I'm discussing the answers you can refer, you can look at those questions, or you can write them down. You can copy these questions down. I can dictate it for you if you want. Question number 25, right? You hear 2, write it like the numeric. Number 2. 2 doctors. For doctors, just write DRS. Discuss the transfer. Discuss the transfer of care for a patient. The question: the patient's 𝐎𝐄𝐓 65 means, you're able to see that 𝐎𝐄𝐓 is written in block letters, capital letters, that he will, option A, be transferred from emergency department. Option B, receive additional medication and treatment. Option C, be treated as an outpatient. 26. You hear a speech pathologist talking to the wife of a patient who has recently suffered a stroke. What does she want to know about her husband's condition? Option A, how long it will take him to make a full recovery. Whether, option B, whether his communication issues will improve. Option C, what she can do to speed the healing process. 27. You hear a trainee doctor asking, you hear a senior doctor asking, a trainee doctor asking a senior colleague about chest tubes. What is the senior colleague doing? A. Explaining how to use them correctly. Option B. Recommending an alternative to them. Option C. Demonstrating what can go wrong with them. Question number 28. You hear a pharmacist talking to a customer about pain relief. What has the customer been misinformed about? Option A, the stock of medication in the pharmacy. The stock of medication in the pharmacy. Option B, the usefulness of a type of pain relief. The usefulness of a type of pain relief. Option C, the availability of a medicine. The availability of a medicine. 29. You hear a trainee nurse receiving feedback. You hear a trainee nurse receiving feedback from his tutor. What does she explain? What does she explain? Option A, listening to a patient's concerns is essential. Option B, how to become more self-assured when interacting with patients. Option C, the importance of providing adequate emotional support to patients. Question number 30. You hear two doctors planning their patient care schedule. What is their priority? Option A, identifying the patients at greatest risk. Option B, dealing with patients who need tests arranging. Option C, ensuring that all patients have key documentation. So I hope you've copied the questions or written down the questions or taken a screenshot of it. So now we'll look at the questions. First, let's look at question number 25. You hear two doctors discussing the transfer of care for a patient. Okay, two doctors are discussing the transfer of care for a patient. The patient's 𝐎𝐄 65 score means that he will, option A, be transferred from the emergency department, receive additional medication and treatment, be treated as an outpatient. Okay, let's read. So you have something like part B, questions 25 to 30. In this part of the test, you will hear 6 different extracts. In each extract, you will hear people talking in a different healthcare setting. For questions 25 to 30, the answer A, B, or C, which fits best according to what you hear. Now look at question 25. You hear two doctors discuss the transfer of care for a patient. Now read the question. So Dr. Broderick, the male voice. Hello, Dr. Salvos. This is Dr. Broderick from the emergency department. I'm calling you with regards to an admission to the hospital medicine service. Dr. 𝐎𝐄𝐓, that is the female doctor, is saying, yes, hello, Dr. Broderick. I'm the admitting physician for hospital medicine. Can you tell me more about the patient and why he needs to be admitted from the emergency department? And the doctor is saying, the doctor one, male doctor, is saying, sure. So the patient is a 68-year-old man with a past history of 𝐎𝐄𝐓 DM2 and a chief complaint of shortness of breath for 3 days. Chest x-ray shows a right lower lobar pneumonia. His vital signs are normal, but his BUN is 36. So the female doctor is saying, see, it sounds like he meets 𝐎𝐬𝐲 65 criteria for an inpatient admission. Okay, he meets the criteria for an inpatient admission. So what are the options? We have transferred from emergency department. That means it can be transferred from the emergency department. Then we have an option there where they say receive additional medication and treatment, where they're saying that he gets additional medication and treatment and be treated as an outpatient. So nowhere they're talking about outpatient, they're talking about inpatient. So we can eliminate outpatient. So criteria 4, he meets the criterion for inpatient. He meets the criterion for inpatient admission. That is what they're saying, right? So we can eliminate that option which says may be treated as an outpatient. So option C is eliminated. And if he has to be treated as an inpatient, he has to be transferred from the emergency department, right? So it more or less matches with the option A, be transferred from the emergency department. But we'll still look at it. Have you started any medications on him in the emergency department? So they're talking about medications of the emergency department. Here what you have to see is they're not saying they're starting a new medication or giving additional medication or treatment for him because he's 𝐎𝐬𝐲 65. Since he's 𝐎𝐬𝐲 65, he's meeting the criteria for inpatient admission. So that patient can be transferred from the emergency department. So option A, be transferred from the emergency department, is the answer. So option A is the answer. So here they're saying, yes, we've given him supplemental oxygen and started him on breathing treatments. He'll also be getting empirical antibiotic coverage. If there are any other orders you'd like me to place, let me know and I'll do so. So here they're saying they gave all the medicines as part of the emergency department thing. It was not because he was 𝐎𝐬𝐲 65. So we are eliminating option B as well. So option A is the answer. Option A, be transferred from the emergency department. Now question number 26. You hear a speech pathologist talking to the wife of a patient who has recently suffered a stroke. Okay. What does she want to know about her husband's condition? What does she want to know? She want to know, underline the keywords, she want to know. For me, those 3 words would be enough to remind me the whole question, that what does she want to know about her husband's condition. So how long it will take him to make a full recovery? How long? That is enough. How long and full recovery? Whether his communication issues will improve. Communication issues will improve. What can she do to speed the healing process? To speed the healing process, what to do? Okay, let's read. Question number 26. You hear a speech pathologist talking to the wife of a patient who has recently suffered a stroke. Now read the question. The wife of the patient is asking, I just don't really understand why my husband can't speak properly anymore. Is it a result of a brain damage? Doctor, the problems of this type are a result of brain damage. Yes, but it's important to note that these issues haven't affected your husband's intelligence. Wife, no, of course. I know it's still him, but it's just frustrating when he can't talk like we used to. Will he get better eventually? So here you have to focus on the questions this lady is asking. What does she want to know about her husband's condition? The first question was, is it a result of the brain damage? So that's nowhere. She's asking about husband's condition. Next question she's asking, will he get better eventually? She's asking if he will improve. Okay, it is not about the speed, what she has to do to just speed up his recovery. No, not talking about the speed. Or the first option, how long it will take. Just asking, will he get better? So it matches with option B, whether his communication issues will improve. Will it get better? Will he get better eventually? Will the communication issues improve? So your husband has shown improvement already. So option B is the answer, whether his communication issues will improve. So your husband has shown improvement already, and we're confident that this will continue with regular sessions in practice. Patients tend to show greatest change within the first 6 months, which is why we've planned such an intensive schedule for him during this time. We're confident that we will see great strides in your husband's condition over the coming months. Okay, so option B is your answer, whether his communication issues will improve. Now moving on to question number 27. You hear a trainee doctor asking a senior colleague about chest tubes. What is the senior colleague doing? Explaining how to use them correctly, recommending an alternative to them. Okay? Demonstrating what can go wrong with them. Here option A and C could be a bit confusing. If you look at the audio, you can see that they're actually talking about how it is working. And there is this one part they say, if you don't hear the sound, it could be because something has happened. All right. They're not focusing on what could possibly go wrong with their machine, but the main focus is on explaining how to use it correctly. Okay, and how it works. Okay, let's look at the audio and it would be more clear. You hear a trainee doctor asking a senior colleague about chest tubes. Now read the question. Trainee, I'm still a bit unsure about chest tubes. I was hoping you might be able to give me a bit more information. So the senior is saying, okay, sure. So you know about the 3 chambers on the chest tube, right? Trainee, yeah. There's collection chamber, the water seal chamber, and the wet or dry suction regulator. Senior, right. So the air from the pleural space passes through the water seal chamber. You should see gentle fluctuation in the water every time the patient breathes. This is called tiddling. If you notice tiddling is no longer present, the tubing may be kinked. Kinked means it might be just, it might have a twist or a curve that blocks it, okay? Former cause to form a sharp twist or a curve, or obstructed, or the patient's lung may have re-expanded. So here, the whole place it is showing how it works, okay? The working or how to use them correctly. So what can go wrong? That part, if you notice tiddling is no longer present, the tubing may be kinked or obstructed. So this is not what can go wrong. This is actually the working of it, how to use it correctly, because if you're not using it correctly, it might be kinked or obstructed. So you have to make sure if this tiddling does not happen, you have to do what has to be done. That is what they're saying. So basically they're giving instructions on how to use it correctly. Okay, training. Okay, you should also make sure the chest drainage unit remains below the level of the patient's chest at all times. So here in all these areas you can see they're talking about how to use them correctly. They're not talking about what can possibly go wrong with them, or they're not recommending any alternative here. Now let's look at question number 28. You hear a pharmacist talking to a customer about pain relief. What has the customer been misinformed about? The stock of medication in the pharmacy, the usefulness of a type of pain relief, the availability of a medicine. Okay, so here you are actually seeing the conversation between a pharmacist and the customer, and where the customer has a misinformation. So customer is misinformed about something. Is it about the stock of medication in the pharmacy? That is, he thinks the pharmacy has got a huge stock of this, but the pharmacy does not have. Is that the case? Or the usefulness of a type of pain relief medicine? Pain relief in the sense they're referring to the pain relief medicine. He thinks that is how it is used, but it is not used for that. The availability of a medicine. He thinks it's available, but it's not. Okay, let's see. You hear a pharmacist talking to a customer about pain relief. Now read the question. Pharmacist, hello, can I help you? Customer, yeah, I get terrible backache and my friend said you could give me some codeine for it. Pharmacist, do you have a prescription from your doctor? Customer, no, I don't want the full strength stuff. I only need the weaker one, you know. They mix it with ibuprofen or paracetamol, so it's not as strong. Okay. Pharmacist, okay, well, first of all, there's been some research done recently that suggests that low-dose codeine does not offer much more pain relief than paracetamol or ibuprofen alone. So what are they saying? If you take paracetamol or ibuprofen alone, you get more pain relief than if you take codeine in low doses. Here, you might be a bit confused about this thing. Option B, the usefulness of a type of pain relief. Here, in option B, they're talking about a type of pain relief. In the audio, you can see them talking about 3 medicines: paracetamol, ibuprofen, and codeine. So, this patient thinks codeine can be used for low dose, can be used for pain relief. Ibuprofen and paracetamol are not that good. So, he is actually having this information about 3 things. Okay, he is misinformed about 3 things. But they're talking about 1 thing, so it does not actually match. So you have to eliminate that option. And we are not actually authorized to provide codeine without a prescription anymore. So I'd recommend picking up some alternative pain relief from the first aisle by the front door. So in the past they could. So they're saying they're not allowed to give it anymore. So this person was misinformed about the availability. He thought it would be available, but it was not. So the availability of a medicine is what the thing that he's misinformed about. Option C is your answer. You have to eliminate. Then now we're talking about the stock of medication in the pharmacy. So we can eliminate that option. The usefulness of a type of pain relief. How useful it is. Okay, he thinks it's useful, but they are in the audio days, they're not saying it is not useful, they're saying it is useful, right? Ibuprofen and paracetamol and codeine can be used for pain relief. So he's not misinformed about it. He's right that it could be used for pain relief, but so we cannot say that he's misinformed about the usefulness of a type of pain relief. Okay, so they're all actually useful. They're all like what he thinks, but one is more, one is less. That is the thing. Otherwise, they're all useful. So we can eliminate option B. Now moving on to question number 29. You hear a trainee nurse receiving feedback from his tutor. What does she explain? Listening to a patient's concerns is essential. This could also be a bit confusing. How to become more self-assured when interacting with patients. The importance of providing adequate emotional support to patients. So you might be confused with option A and option C. Listening to a patient's concerns is essential. How to become more self-assured when interacting with patients. The importance of providing adequate emotional supports to patients. Okay, let's see. 29. You hear a trainee nurse receiving feedback from his tutor. Now read the question. So the tutor is asking, how do you feel you handle the patient's concerns? So trainee is saying, well, I think it was okay. Maybe I wasn't as confident as I could have been. I'm still quite nervous about advising patients. I guess I just need more experience to gain confidence. So here you have to look at what the tutor is saying. Okay, your attention. So tutor is saying, oh, maybe I actually don't feel that was an issue for you. Do you think there is anything else you could have done for the patient during your examination? Well, you could perhaps have tried to be more reassuring rather than just stating facts. So here she's saying you have to reassure them. Instead of just telling them, this is okay, this fever is not very complicated, you have to say, don't worry. You have to reassure them that just rather than just stating the facts. Sometimes patients need to feel like their anxieties are being heard. So here she's saying you have to reassure them more rather than just stating the facts. You have to reassure them. You have to make them feel like their anxieties are being heard. So anxieties are being heard. Okay, they're talking about listening to the patient's concern, but she's also saying you have to reassure. So let's see. Trainee, I actually think I did cover this with the patient though. He talked through his concerns while I was examining him. So trainee is saying he listened to the patient. So the tutor is saying it's not enough for the patient to say they're feeling worried. You have to show that you're listening and you reassure them that you're working with their best interest in mind. So you have to listen to their anxieties and concerns, and you should also reassure them. So they're talking about 2 points, listening and reassuring. So option A is only talking about option A. Okay, look at this. Option A is only talking about listening to a patient's concerns is essential, but she's also saying about reassuring. So how to become more self-assured when interacting with patients? She's nowhere talking about option B, so we can eliminate option B and option A. Option C, the importance of providing adequate emotional support to patients. So you're listening to them and you have to reassure. So that is providing adequate emotional support to patients. Option C is the answer. Now, question number 30. You hear 2 doctors planning their patient care schedule. What is their priority? What is their priority? Identifying the patients at greater risk, dealing with patients who need tests arranging, ensuring that all patients have key documentation. So one point is about documentation, one is about test arranging, other one is about risk. Okay, what is their priority? Let's see. Question number 30. You hear 2 doctors planning the patient care schedule. Now read the question. So Dr. 1 is saying, we have 24 patients in total to see today across 2 bays. And unfortunately, we only have 4 staff members. And I think we should divide ourselves into 2 teams. Would you agree? The second doctor is saying, absolutely. Also, I think we should see patients according to their national early warning score. We should see patients according to their national early warning score. That way we'll get through all those who have urgent requirements before lunch. So they're saying first we have to look at the patients according to national early warning score. So what is their priority? Look at patients according to their risk. They can be sure that the most pressing investigations are performed earliest, and the sooner we get those organized, the better. Now, where they're talking about test arrangements, like dealing with patients who need test arrangements, no, they're not talking about it. They're saying we need to look at them, see the patients according to the national early warning score. That way we'll get through the urgent requirements before lunch. Then we can be sure that the most pressing investigations are performed at the earliest. Okay. So dealing with patients who need test arranging, no, that is not what they're talking about. Ensuring that all patients have key documentation, no way they're talking about documentation. Identifying patients at the greatest risk. Okay. Okay, urgent requirements. That way we can get through all those patients who have urgent requirements. Identifying patients at greatest risk. Okay. So then we'll read the remaining part as well. Phlebotomist, a phlebotomist is a medical professional who's trained to perform blood tests, blood draws. They can collect the blood for testing or donation and can also perform blood transfusion. So they're trained for blood collection. They can use it for blood testing or donation or even blood transfusions. We'll be coming to the ward at around 1:30. So any blood form should be given to them then. Okay, so now I'll show the answers once again. You can see the answers. Question number 25, you hear two doctors discuss the transfer of care for a patient. The patient's 𝐎𝐄 65 score means that he will be transferred from the emergency department. Option A is the answer. 26, option B, whether his communication issues will improve. Option 27, option A, explaining how to use them correctly. 28, option C, the availability of a medicine. 29, option C, the importance of providing adequate emotional support to patients. Question number 30, option A, identifying the patients at greatest risk. So I hope it's clear to you. If you have any questions, please feel free to comment. If you don't, we'll meet again in the next live on Wednesday at 8 p.m. Stay tuned. Bye-bye. Take care and good night.